Hi Sita, you alright?
Yes, I'm fine, thank you. Are you?
Good, thank you. Yes, you've come today for a simulation, is
Yes,
that right?
that's right.
Okay, are you ready to go? Is there anything you need?
No, I'm fine, thank you.
Okay, excellent. So I'm just going to tell you a bit about the case, if that's alright, and then you can repeat it back to
Okay.
me. So you're going to be looking at Alan,
Yep.
and Alan's a 35-year-old on the surgical assessment unit,
Okay.
and he's come in with right iliac fossa pain,
Yeah.
presumed appendicitis.
Okay.
The reason you're being called is because his obs have deteriorated a bit, so the nurse that's looking after him is worried.
Okay.
Do you want to just repeat that back to me?
Yeah, so we've got Alan, who's 35 years old. He's got acute appendicitis and he's awaiting surgery. He's acutely deteriorated, so I've been asked to see him, and he's on the surgical assessment unit.
Good, and you've got a nurse to help you who's Ella.
Okay, brilliant.
All right,
Thank you very much. Hi, Alan.
Hello.
Hello. My name's Sita. I'm one of the surgical doctors. How are you?
I'm okay, I'm not feeling great, to be honest.
Okay, fine. So what I'm going to do is just do a quick assessment, and then we'll see what's going on and try and help you feel a bit better. Okay, so I can see his airways are patent. I'm going to just move on to B. Ella, can I have a bit of help, please?
Yeah, of course,
and
yeah.
can we put some monitoring on for him? So oxygen saturations, could we get a blood pressure and a heart rate as well, and a temperature, and see what his respiratory rate
Yeah, of
is?
course.
Okay, so Alan, I'm just going to get a stethoscope and have a listen to your chest, all right?
Okay.
So, can you try and take some nice deep breaths in and out?
Wheeze, 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 and wheeze.
Okay. So, I'm just going to gently tap on your
I'm just going to
chest,
pop a blood
okay?
pressure. I'll come around there. Normal. Pop a blood pressure cuff on.
That can be
Normal.
as well. And so, what's his respiratory rate and oxygen saturation? So, I can see his saturation is at 90%.
I'll do the temperature
And
as
his
well.
respiratory rate's 28.
Sorry,
You're
just
wheezing
down.
quite a bit. Thank you, Alan. So I'm going to give you some medication just to try and help with that. Could we get some salbutamol nebulizers, please, to give, if that's all right? So hopefully this should just help, because I can see you're wheezing and you're struggling. Okay,
Do
fine.
you want these through air or oxygen, doctor?
Can I just have them through air, please, if that's okay? And could we sit Stanley up? So just...
You notice as well that he's quite swollen in the face and quite
Okay.
red.
Oh, right, okay.
Got a rash.
Fine. Is it just on the face that he's got a rash, or can I have just look at the rest of your body and your tummy, please, if that's all
Yeah,
right?
when
So-
you look at that,
Yeah.
he's got a red wheels.
Okay, so
over his
I'm
abdomen as
worried.
well.
Has he had any medication or anything like that recently? Do we have a drug chart?
Yes, actually. So I've just given him his antibiotics. It's Comoxiclav, actually. It's up there. It's just.
Oh, right. Has that just gone through now?
Yeah, I
Okay.
had about 10 minutes ago.
Alan, are you allergic to anything? I'm so sorry.
I'm allergic to penicillin.
You're allergic to penicillin, okay. So actually, I think you're having an allergic reaction at the moment. We're going to try and give you some medication to help with that.
Shall I stop it, doctor?
Yes, please,
Yeah.
if you can stop that. Can we get some adrenaline, please, actually? I don't actually know the dose of the adrenaline that I need. Do we have a guideline, if that's all right?
I think we do, yeah.
Okay, fine.
So what do you want, sorry?
So adrenaline, 500 micrograms, if that's okay. I'm not sure we'll be able to get it through there, but you may need to draw it up if that's okay.
Yeah.
So 500 micrograms, please. Okay, whilst we're waiting for the adrenaline, I'm just going to go through and do the rest of my assessment. So looking at circulation, I'm just going to check a capillary refill time. 1, 2, 3.
1, 2, 3.
Fine. And do we have a blood pressure as well at the moment?
Yeah,
So
it is what it is, just been done now.
70 over 32, okay, and heart rate of
How did you
154.
want it, sorry, doctor?
So in IM, please, if that's okay. Are you happy to give that?
Yeah,
that's fine. Thank you
I'm just
very
going to
much.
give this into your 5.
Let me just have a look. So from a circulation point of view, we've got one cannula, so I'm just going to stop that as well.
Okay, that's gone through, doctor.
Brilliant, thank you. Can we get some IV fluids, please?
Yeah.
So could we get some normal saline and 500 mils, if that can go up stat, please? So the blood pressure is very low at the moment. Okay. So I'm just going to go back and reassess now. Alan, how are you feeling?
I'm still feeling a bit short of that.
Okay, fine. And the nebulizer's going through at the moment. Okay. And we've got saturation still 90% and respiratory rate still 28. Okay. We're giving the fluids through at the moment. Okay. Brilliant. Thank you very much. So I'm just going to move on. I'm still not quite happy with B and C at the moment, but to have a look through. D. So is alert talking to me, so it's an A on the APU. Do we have a BN, please?
I can get one, yeah.
Yeah, that'd be great. And a temperature as well. So did you?
I did take one earlier, yeah, I wrote it down, I think.
Oh, do we have his obs chart actually? And I can have a look at that. That's great. Thank you very much.
I'll get that again.
Yes, please. So temperature was raised about half an hour ago, but actually it's coming down. It's 37.9 at the moment. Okay, fine.
Okay,
Great.
so that's 6.4, that's fine.
Fine, okay, that's okay. So moving on to E, I'm just going to expose, and I've seen that there is a rash there, but I've started treating. And how are you feeling, Alan?
I'm still feeling a bit short of breath, but my chest isn't quite as tight anymore.
Okay, good. So I think you've had an allergic reaction to the antibiotics that you've just had, okay? So we've given you some medication to help with that. Hopefully you should start to feel a bit better. But we'll just recheck everything, and then we may need to give you some more of that medication again, okay? Fine. So has the nebulizer gone through?
Yeah, so that was just finished. Do you want
Okay.
another one?
So I'm just going to reassess now. We've got SATs of 92, but respiratory rate's still up. Okay, so
Yeah, loud wheeze
a
now.
loud wheeze.
A bit louder than before
Okay.
in all 4 areas
In 4
equal.
areas. Shall we give a little bit of oxygen actually as well now that the neb has gone through? The wheeze is still there, but it's a little bit better, and I think yeah, let's give a little bit of oxygen. Can we give maybe 2 litres via a nasal cannula, please?
Yeah, of course.
Thank you. Okay. And so we've had the fluids going through. Is that? Could we repeat the blood pressure as well?
Sure.
Yeah.
Yeah, I'll do that now.
And I'm just going to have a look back at the guidelines to see.
That's fine, that's it.
Okay, so it's a little bit better. And if that fluid's gone through,
Pop
can
this
we?
off and swap this round.
I can get that for you. Actually, we'll get some fluids. So I'm just going to give some normal saline and another litre to go through, and I'll prescribe that in a moment for you. All right. So, fine. So the oxygen's on now. We've got some more fluids going, and I think it's been 5 minutes now actually, and we're still not really getting as much of a response. So could we give some more IM adrenaline in?
The same dose.
Yes, please. So 500 micrograms again. Alan, how are you feeling there?
A bit better, I think, with this one, but still wheezy.
Still wheezy, okay. We'll give you the oxygen for a little bit longer, and then I think
That's
we
just
need
gone
to... Great, lovely, thank you very much. Okay. So, when I reassess now, how is his breathing? Is that getting better?
Breathing
Great.
seems to be easing up a bit.
Yeah, okay. Moving on to blood pressure and heart rate.
Shall we do the blood pressure?
So that heart rate is quite high as well, and actually the blood pressure is improving, which is great. At some point, if we can, could we get an ECG for him? Yeah. Okay. And then examining and exposing, how is the rash now?
Seems to be getting better.
Okay, fine, good. So I think we'll continue as we are, and I'm probably going to call one of my seniors, and he probably needs to be transferred to epilepsy for a little bit of monitoring, or to go to theatre immediately, but I'll call the
Okay,
seniors.
well, your senior consultant is here actually.
Okay.
Could you just come in? So would you mind handing over this patient to your senior consultant?
Hi, sorry to bother you. I'd just like to discuss Mr. Smith, if that's okay. Is now an okay time? So he's 35 years old. He's come in with acute appendicitis and is actually waiting surgery. I've just been to see him because I think he's had an anaphylaxis reaction.
Okay.
He's had some penicillin. He's got a penicillin allergy, but he's had some coamoxiclav earlier. So I've started some treatment. I've given him 2 boluses of adrenaline. He's on oxygen at the moment and IV fluids, and he seems to be responding. But I think we need to move him to a high dependency unit for further monitoring before we get him to theatre.
Okay. Yeah.
Right. Thank you, everybody. That's the end of your sim. Well
Thank
done.
you very much.